Hey, so I'm just recording this in my car, but I went and saw the what you call it, I don't know what Dr. Costantino actually is. It ENT, a surgeon? But I saw him. I uploaded my DICOMs and to his office. Made an appointment like 2 months ago, and then I think like yesterday or whatever I had the thing like telehealth, and he looked at my CTV and he was like, "Oh yeah, that's the worst it's ever, or one of the worst I've ever seen for internal jugular vein compression." So that was nice to hear because my neurosurgeon I'd just seen like a few weeks prior was like, "Yeah, no, you don't have any problems." He gave me a catheter venogram. Was like, "Yeah, you're fine," and I'm not fine. I've compressed veins, and so that's why I got the CTV. And I looked on the CTV on the the radiologist who reviewed it was like, used a bunch of fancy words to say that the right internal jugular vein was blocked, the left one was mostly blocked around C1, and which I already knew, and but then I also looked at the CTV itself, and within like 2 minutes, because I was like, how the heck do I use this software again? Like it's been so long. After about 2 minutes, I figured out how to do all the controls, like zooming in and out, changing the contrast and all that, and then I looked on the blood flow through the right internal jugular vein, and it was like really pinched off. It's like someone stepping on a garden hose. So that took me like 2 minutes, and and my neurosurgeon couldn't figure that out. I mean, I'm not an expert in reviewing MRIs or CTVs like CAT scans, but it's also not hard to do. So, I mean, you can just Google what you're looking at and figure out, like, okay, that's the styloid, that's the transverse process, that's the internal jugular vein. So, um, yeah, I mean, I'm not saying radiologists are pointless, you know, but I'm just saying, like, the basics are pretty easy. Uh, Although there isn't an image that I haven't read better than a doctor. I mean, I'm not better than the radiologist, but when the doctors look at it, I'm like, so did you see this? Did you see that? Did you see the other thing? And they're just like, no. It's like C1 rotation, lack of cervical curve, degenerated disc. Like you didn't see that. You know, possible pinched nerve. Like if I move my head a certain way because the bones are touching, they shouldn't be touching. The two, I don't know. I just figure if I was a doctor, I'd be like, want to know these things. Point them out to a patient. Um, Maybe, yeah. But he seemed like he was talking about cutting off. Dr. Costantino was talking about just chopping off a piece of the edge of the transverse process of C1. And I said, wouldn't that cause like instability? I mean, on every transverse process on your whole spine, you've got tendons connected to muscle. So if you chop that off, that muscle's not connected anymore. Like there's muscles that connect to you. So I don't know. He said that the part he's chopping off is just attached to fascia, so he's not disconnecting any muscles. And I mean, obviously, fascia holds your spine together too, hold your head, but it's not as critical as a ligament or a tendon. So, and he said, and he never had anyone get any kind of instability from his surgery, like not one person. So I was like, all right, well, sign me up. So, because it would be nice to have blood flow in my internal jugular veins, and so we're working out insurance stuff, and hopefully that'll help. Um, because that'd be one less problem to have, you know. So, yeah.